Good morning, everybody. Greetings from the land of temples, Nadiyad. Myself, Dr. Abhijit Patil, Organizing Secretary of Euro Practice Con, would like to welcome you from the bottom of my heart. There are a lot of conferences across India to cover up all the urological diseases that we have. So this time what we thought is let us focus on the core thing that we practice day in, day out. So there are many problems that youngsters face, and the seniors over the period of 15-20 years, they have learned something out of their practice. These things will come only with grey hair. There are no guidelines, there is no textbook on it. Only a grey hair can teach a black hair. So with that concept, we came up with this thought of having Euro Practice Con. And since this being a West Zone USI midterm event, I would like to welcome on stage our Honorary Secretary, Dr. Rajesh Kukreja, sir, to speak and welcome the conference.
Thank you, Abhijit. Welcome all delegates, and nice to see all of you. And I'm very sure that in a few minutes there won't be any space to stand also in this hall. Looking at the number of registrations we've received. So on behalf of the Council USI West Zone, I welcome you all for this midterm activity, which is co-hosted by the West Zone and by the Muljibai Patel Urological Hospital. I thank Dr. Sabnis sir, Abhijit, and the entire team of Muljibai Patel Urological Hospital to take this initiative on a very good practical topic, and that's why we see all this response here. Thank you, Team MPH. Thank you very much. Now, may I now invite our President, Dr. Ashish Patil, to please address and declare this meeting on.
Thank you, Rajesh, and good morning, everybody. And I welcome you all to this CME, midterm CME of the West Zone Urological Society. At the outset, I would like to thank all of you for registering for the conference. And it is indeed surprising to know that there are so many urologists who are still, I mean, they want to learn how to practice, and that itself is quite an interesting thing to know. I would like to thank Sabnis sir, MRD sir, and the entire MPUH team for having taken the initiative and organized the event with such an interesting program. And I thank all the council members to have supported us in this endeavor. And I welcome you all once again, and I declare the meet open. On behalf of the Urological Society of India, I would like to welcome Dr. Keshav to come and give a couple of opening remarks. Thank you.
Thank you, Ashish. Good morning, everybody. I bring greetings from the Urological Society of India. It's a pleasure to be amongst you for this West Zone Euro Practicon, which is a non-urological CME, which is generally held here. I remember Euro Finance was held here under the leadership of Dr. Sabnis, and that's how the non-urological CMEs. We have covered a lot of topics, and I see this program, which is much more elaborate. We tried doing this in Chennai last year as Euro Practice Con, but this program has got a lot more details which are curated into this program, which will interest the younger urologist and also get the insights from the seniors who have gone through all these things. So I hope all of you will benefit from this. I must thank Dr. Sabnis, Dr. Abhijit, Abhishek for conducting this program here, and greetings to all of you. Let's have a 2-day, 1.5 days of good scientific program. Thank you.
So now we will start the session. So each session is focused on a specific aspect of urology practice. So the first session is regarding accreditations for a hospital. May I call upon stage Dr. Prashant Muralkar and Dr. Haresh Tumar, welcome sir, as moderators for the session. And the first speaker, may I call upon stage the first speaker, Dr. Kishore Vani, to speak on different accreditations available for the hospital.
Good morning, friends. We are the umpires for the opening batsmen. So we have got enough time. We'll watch everybody. We'll relax. And the opening batsmen are going to speak about accreditation. When you pass out, you start your practice, start working. And you start to think, am I doing it right? Am I doing it as per the protocol? And is there a benchmark which can judge me, which can grade me, either as a good batsman, good bowler, or an all-rounder, or a good facility? So different accreditations are available, and we are opening this session with our own Kishore Vani, who will be speaking on different accreditation for the hospitals. Over to you, sir.
Thank you, sir. Good morning, all. First of all, I'd like to thank Western Council for giving this opportunity. We'll be talking about different accreditation available for the hospital. It's a very vast topic, but I make it very short of 8-minute duration. So why we need accreditation? Because it is what is accreditation rather? Accreditation is a permission or a process which is given by a recognized body to a particular hospital or hospital industry, which fit into their criteria of compliance, which probably will helpful for increasing the quality of healthcare and will increase the safety of the patient care. So it is not only about standard setting, but it has many dimensions. Like it will allow hospital to have self improvement in conducting all the surgical things, protocol like billings, documentation, and everything. So basically, it is a quality assurance and medical ethics, which ultimately reduces the medical error in treatment of the patient. So it is one of the component of maintaining the good quality practice in many hospitals in India. So why accreditation is important? Because it will assure the quality care to the patient. It will definitely give safety to the patient care. All the qualified staff which will be appointed in that particular hospital according to the accreditation will create a better workforce for the patient care. And there will be a transparency and accountability in maintaining the records and keeping the records. So what are the different type of accreditations available in India? There are many, but these are the major ones which we follow. Like number one is ISU, then NABS, JCI, NABL is for laboratory, and this is something which is called as NABS digital. So what is ISO? So ISO is basically a implemented system which is based on quality management, and that has been given to the particular hospital. If that hospital norms comes under this quality management system, these hospitals are certified for the ISO. Basic aim of ISO is to deliver high quality, safe and efficient healthcare services to all patients. So increasing the safety of the patient. So what are the benefits of ISO? Number one, it will improve the quality of the care. It will enhance the patient safety by reduction in lot of medical errors which happens without documentation, and definitely it will increase the efficiency of the staff, and at the same time it will save the costs also. Definitely it will enhance the reputation and trust of the hospital in general, and patient many times see on Google the hospital, and if the hospital is ISO certified, then probably they will prefer that hospital over non-certified hospitals. Definitely, if the hospital is accredited, then all these government regulatory bodies will have better compliance, because there are standards which the hospital is following, and which probably government regulatory bodies will also have easy to recognize these hospitals in particular. And the improvement in the staff training and development will definitely increase the patient care at the end of the day. So there are different type of ISOs available for the health industry, but the main ISO which hospital requires is ISO 9001. Rest of all, either it is for the environment management or occupational health or medical device or security management. There are different types of ISO. But as far as hospital is concerned, I think ISO 9001 is the specified thing. How hospitals achieve this? It is first of all, hospital has to apply to the body. All the body will give the quality management system to the hospital, and hospital has to follow all these systems in 6 months time, and then they can do their internal audit. Once they are happy with their internal audit and have all the queries solved, then they can apply for the external auditors, which is sent by ISO certified auditors, and they will have inspection, and if they are okay with this, then they will certify this hospital as ISO certified hospital. So ISO certification is a valuable tool for hospital seeking for improvement in quality, safety and efficiency of the patient care. By implementing and maintaining the robust quality management system, hospital can demonstrate their commitment towards excellence and enhance patient care, ultimately leading to the better health care for tomorrow. This is most commonly applied accreditation or required accreditation in India. I will not go into details of what is the advantage disadvantage because that will be covered by subsequent speakers. I am just going to share how we get this and what is the importance of this accreditation. So NABH is the National Accreditation Board of Hospitals. Basically, it is established in year 2006 as the constituent of the Quality Council of India, which is the government undertaking body. And first edition of NABH has been came and released in 2006. And every 3 years they update their system and their protocols, and the hospital has to apply every 3 years for its renewal. Currently, we got the 6th edition of NABH standard, which is starting from January 2025, which has more chapters of accreditation compared to previous ones. And the organization will reassess all these hospitals every 2 years. And if you want to renew the NABH certificate, you have to apply 6 months before the expiry date of the certification. The main focus of NABH is ultimately to ensure hospitals to adhere to the national guidelines for the quality and patient safety. The purpose of NABH is to improve the healthcare system and promote continuously for its improvement in the hospital care. The process is like the hospital has to undergo self-assessment first, and then they go for the external auditors of the NABH, and whatever the norms NABH has to give to the hospital, they have to follow that norms for at least for 6 months. So hospitals they assessed over 600 different parameters of the NABH, and once you are okay with these 600 parameters, then hospital need to have a process-driven approach in all aspects of the hospital activities. So NABH will not only cover the patient care, but it will cover the accountability of the patient, billing part, non-medical part of the hospital. So it is in general which will streamline the entire operations of the hospitals. There are what NABH usually performs 3 different activities, like they accredit the hospital, they certify the hospital, that is called as entry level, and there are different empanelment which NABH gives to the many hospitals. So there are basically 2 types of NABH. One is entry level NABH, that is they call it a certification, where a small scale hospitals, clinics, laboratories, they can apply for this entry level, where the standards rules are little less stringent than the full NABH certification. So this NABH certification is only at the entry level with minimum standards given by the NABH, and if they follow the standards then they will give you initial certification. Accreditation is for all these bigger corporate hospitals which are more than 100 beds, and they got different 10 chapters of their standard which hospital has to follow, and then the NABH certify this hospital as a NABH accredited. So what are the importance of NABH? Again, it is to enhance the patient safety and give quality care to the patients. Definitely, NABH hospital has more reputation, and it will more trust. It will have more trust of the patient. And it will facilitate the medical tourism, because many patients outside India who comes to India, they see all these accreditation before they go to the hospital. But there are few challenges as far as for the small setups, where the resources which are limited in the small setup is very difficult to match with these NABH standards. Documentation will take extra cost and extra money and extra staff to fulfill this, so there is extra money involved. Definitely, NABH required lot of infrastructure changes. So probably that is again a cost adding to the smaller hospitals. And the training and awareness, keeping a qualified staff, keeping a qualified nurses will again have extra burden on the smaller hospitals. So probably these are the challenges, but there are many modifications NABH made for the small hospitals to reduce the cost of it. So the procedure is you have to apply for the online to the NABH first. Then they will we have to give a what was called as self-declaration form. Then application is reviewed by the NABH team, and they will pre-assess all the parameters, standards, account on what way hospital is working on, and the final assessment is done by the NABH team, and they will certify this hospital as a NABH accredited hospital. There are different chapters of NABH standards that hospital has to follow before they accredited for the NABH standard. NABL is meant for the laboratory. Again, they got the standard format for the standard developed for the different laboratories. And if that laboratory form fulfill that formality, then that lab is called as NABL accredited form, accredited laboratory. This is NABL Digital Health Standard, where NABL came out with the first edition of this new accreditation that is called as Digital Health Standard Hospital. And mainly Government of India want to make all these hospitals on one platform, one digital platform, but there are a lot of lacuna in following this. Under the JCI, that is called as Joint Commission International Accreditation, the objective of JCI was to ensure every patient receives the highest quality of care possible based on the quality accreditation of the program. The healthcare organization need to undergo a structured process involving the self-assessment, implementation of standards, and rigorous on-site survey and ongoing improvement of the efforts. So this is the way you can apply for JCI. Again, the initial preparation and application is given to the JCI. Then you have to self-assess your hospital standards according to the JCI norms. Once you are okay with the norms and you implemented all these norms as per the guidelines of the JCI, then you have to call the team from the JCI. They will come on site for the survey. They will assess all their standards, whether hospital is following all the standards or not, and it is absolutely a JCI decision on which basis they will decide whether this hospital is either accredited, whether they can give a provisional certificate or a conditional certificate based on some lacunae, or there is a denial of the certificate. So basically, accreditation is a compliance, is not one-time event, but it is an ongoing process for the hospital industry. And accreditation is just a beginning rather than end of your quest for the quality. Thank you.
Thank you so much, Dr. Kishore Vani sir, for enlightening us about various ways to accredit hospital like JCI, NABH, ISO. It was a fantastic talk. I think questions will take in discussion part. So accreditation is not optional for people who want to excel in this center. So we learn about different kinds of accreditation. Now we learn about is it worth to get it and how do we get it. So I'll request Dr. Ashish Chajet to enlighten us about the next topic, is accreditation worth and how to achieve it. Tips and tricks.
Good morning, everyone, and thanks West Zone Council for giving me this opportunity to present this talk. So I'll just build on what Kishore Vani sir has already told. Next. So question is accreditation worth? Just have a there is this study from WHO Global Patient Safety Report 2024, which says that unsafe healthcare is a major global health problem, and it affects 1 in 20 person which is in need of healthcare, and this is especially vulnerable in adults and children and ethnic minorities. Just look at this slide. These are doctors and staff carrying a hospital cart on a square wheel, and somebody is offering them a circular wheel, and they are refusing it. Why? Why they are refusing it? Because we feel the accreditation is unnecessary, it is expensive, it is intrusion to their autonomy, it is wastage of their time, it is exposing the deficiencies of the hospital, And also, we may feel that who are they to tell us how should we run our hospitals? But always remember that with great powers, there always the responsibility. So, already sir has covered that NABH is important to develop a public trust, to improve the sensitivity of the patients and hospitals towards the patients, to make patient staff satisfaction more important, and for empanelment of insurance companies. These are benefits which have already been covered by sir. So I will just break down that NABH process 10 chapters and just reveal how you should go about getting a NABH. So this is the process of NABH in which, as sir told, we have to apply online, and then there will be some 10 chapters which we have to comply. So these are the 10 chapters which will guide us to get a NABH certification. So first 5 chapters are related to patient-centric care, and the next 5 chapters are related to the organization of hospital-centric care. So every standard, like these 10 standards have 13, 20, 11 multiple substandard, and each of them will also further have a substandard, and thus there will be around 639 points which are called as objective elements on which your hospital will be judged. Out of these, 105 are the core parameters. These core parameters have to be fulfilled. So these are the scoring, and the passing mark for the hospital is 80%. You have to comply with at least 80% of this norm to get this accreditation. So we will just, the amount of data and processing is too much for our entire discussion. So we'll just take a few very relevant points in these 10 chapters. So first chapter is related to the patient care, how the patient comes to the hospital, how he is getting enrolled in their system, OPD, IPD, everything. And important are these, like this, all these 13 chapters are again having these 3, 4 multiple subheadings, and there are many few points which are core in these topics. So one core point which I am just highlighting here, for example, is that to get NABH standard, core criteria is patient should have a unique identification number, so that we can get by any good hospital management software. The second chapters deal with patient care. In this, all the care related things from IPD care, nursing care, obstetric care, OT care, these things are covered in this chapter. This has 20 points in which the NABH has laid down these criteria. And again there are 19 core elements, 13 core elements which need to be followed for the accreditation. Third point is related to the management of medicines in the hospital. How you are prescribing, are these rational? Then is the staff clearly giving the instructions? Is the medicine being properly followed? These are points covered in chapter 3. Chapter 4 covers patient's rights, like whether he has been informed, when consent has been taken. These are very relevant and important things which this chapter covers. Fifth point is infection prevention and control. Again, very important for us surgical people, and in which these points, important core examples which I have taken is the organization. There are specific points for the organization to have a standard precautions to be used. Hand hygiene is very important part, and NABH has specifically highlighted getting hand hygiene guidelines in the hospitals. Then safe injection practice, infusion practice, antibiotics, antimicrobial stewardship, whether what antimicrobial policy are you following in hospital, that is also judged. Then we come to the organizational centric standards, in which the first is patient safety and quality improvement. These standards are mainly for the patient safety, which normally when patient comes, how is he monitored? Is there any clinical audit going on? How is he follow up? What are the ways to improve the patient care in this hospital? Next is the responsibility of management. This is again related to the management services. Who is the leadership role of the hospital? How is it run? Who are the patient? Who are the persons taking the decisions here? The next is the facilities management, in which we are judged based on how well we are providing services, whether it is safe water, drinking water, any non-smoking areas, manage hazardous materials. So the key points here is that there should be clear-cut signages which will give you points. Then medical gases should be properly stored. Then alternative sources of medical gases should be available in case of there is any shortages. Ninth chapter relates to the human resources. All the criteria related to the doctor-patient ratio, doctor-staff ratio. Again, there are very important points which needs to be covered, which will give you good points, like staff should be properly given induction training. Then she should be, whatever is responsible, should be trained in cardiopulmonary respiration. This. Then 10th chapter is mainly covers the information management. This is all related to the data, the patient, how the files are getting stored, what is the privacy which is followed in storing the IPD data. So firstly, for getting accreditation, hospital should have a firm commitment and willingness to undergo this process. It's a long and tiring process. At times, very middle of the way, you can think that why I'm doing this unnecessarily. But the second part which you should focus in getting this is that all the essentials that has to be there. The fire NOCs, the hospital registration, pollution certificates, compliances with the local municipal bodies, pharmacy licenses. Hospital infrastructure, we should try to make it as NABH compliant as possible. IPD, as I already covered, that hospital management service is a very software is a very important part in getting this accreditation, because it will standardize lot of things automatically. UHID number is a very important criteria which will identify your patient. All the infection control protocols needs to be followed. You should create a committees which will take care of all these infection control. Then you prepare SOPs for your staff. Then all the swabs needs to be taken, and more importantly is that you should document every good as well as the adverse event which is happening in your hospital. Signages are very important points in which will give you a lot of points in doing NABH accreditation. So these are the various types of signages, the patient character, then scope of services, hand rubbing. This should be placed in multiple areas of your hospital. These are very important points with the registers. There are around 50 to 60 registers which NABH says needs to be implemented. But good point here is that most of these registers are negative registers, that there is nil registers. You don't have to put many things. So the staff needs to be very well managed. There should be very good ratio of adequate ratio of bed to nurse, bed to doctor ratios. Safety drills, patient needs to be trained in, the staff should be trained in getting safety drills. Team should be built. So as you see, this accreditation is a journey from dragging this hospital from a square wheels to this comfortable place where the patient is getting cared, your staff is trained, your doctors are happy, and your hospital is safe. Thank you.
Thank you, Ashish. Now, there are many awards for the hospitals. Some newspapers carry awards, some private organizations also award, and at least once in a month you get an email that your hospital is selected for this and this award, which will be handed over to you in Singapore or maybe some places like Dubai and Azerbaijan. So all are these awards worth, and which are the good awards we should strive for? To ponder on this point, I call upon Ashit Bhai. These are the good awards for the hospitals. One we should treasure, one should try to acquire these awards. Over to you.
Thank you, Prashant.
Thank you.
It's always a pleasure and privilege to talk at one's alma mater. Good morning, everybody. Let me start with two short stories. These are real stories. This is a letter from Amitabh Bachchan wishing me on my birthday. This was given to me by a multinational pharma company many years back. I was surprised because I know Amitabh, but he doesn't know me. I've never seen him also. So I was like, I don't take any favors from pharma for conferences, for hotels, for state travel, anything. So I said, what? How? How do you get this? He said, sir, we are giving it to some selected doctors. And I said, okay. So I just put it into my closet and forgot about it. Many years later, there was renovation going on in my house. So my wife took it out from the closet and hanged the picture in the kitchen. And this is where problems started. A lot of patients would come to me and ask, sir, have you treated him? Sir, how is he as a person? Sir, have you operated him? So initially I used to say, no, I haven't done it, and I give the explanation. Then I started doing what, Lord Krishna told to Arjun, Yudhishthir in Mahabharata. I just smile. Whenever they ask me the question, I just smile, Narova, Kunjarova. So the idea is what I'm trying to tell you is how a birthday greeting, simple birthday greeting can make things, Let me come to a second story. So this was the year 1989 when the then President Shankar Dayal Sharma inaugurated the literacy machine here at MPUH. And thank you, Kalpesh Bhai, for giving this from your archives. And here, Professor Mahesh Desai sir is seen introducing my teacher and mentor, Snehal Patel sir. Snehal Bhai is unfortunately no more. He was also practicing in Baroda. He is practicing in Baroda. And sir had put this picture in the reception at it. Now, many years later, I thank Kumkum Gabi for the previous thing. She was kind enough to give me this picture for this presentation. So, 3 to 4 years later, I started practicing Baroda. And after a couple of years, I just got a call from Singh of OT from the electrical thing that sir wants you to come down. So I went there. So I went in the OT, and sir was basically operating a case of huge upset. There was a young kid. There was no expression of contrast on the IVU. That time no CTs or DTPs were available, and so it planned from the flat top. While he was inside, he saw that the contact was quite good. So he thought, why not preserve this people? All the relatives talked to them, but the relatives said, no, sir, we won't have a second opinion. ठीक है, किसका लेना है तो आशीष शाह. So that's how I was called. I feel very embarrassed. I said, I'm sorry, sir. There's nothing right. You just go ahead and talk to the relatives outside. So I go outside and talk to the relatives. I said, sir is my mentor and teacher. He is the person who has taught me how to do this. And I said that please follow. He always talks about the patient's interest. That is when one of the relatives, sort of pointed out. He said, yes, sir, we can see this picture also. He has also operated Shankar Dayal Sharma, the president. So again, I just smiled and came out. Later on, whenever I used to refer patients to sir for a second opinion, many of them would come back and tell me, oh, sir, we to Shankar Dayal Sharma ka operate kiya. I said, ji, ji. See, the story is, the idea is human minds are great storytellers. You see a picture and start making a story on that. With this background in mind, let me talk about hospital levels. I bring greetings from Ashray Urology Institute, Vadodara. Artificial intelligence, as you see, has been used for creating some illustrations. Basically, awards are of two types. One is evidence-based, which by previous speaker Ashish he has talked about already. Those which are earned with sweat, and the others are sponsored awards. Those which are with red class. Best hospital award, the healthcare icon award. So that is what I am going to talk about. So basically, these awards are all about visibility and vanity, if you ask me. About 2 months back, I received this email saying that you have been selected in the top 10 kidney transplant surgeons of the country. So I don't even do kidney transplant. So I was like, wow. So then I searched, from a magazine called Silicon India. I searched and found out that Silicon India is a respected US-India magazine working for last 14 years in India. 14 years in India. So this is how things work. So let's just go into the anatomy of a paid award. First step is call for nominations. Then there is an evaluation process, so-called evaluation process. Then the result where you are declared, and then you are given a marketing bundle. Let's see each one by one. So you, as Prashant said, you get an unsolicited email. Please send your photo and a picture, and you are selected for this award. You will be taken into a 5-star or 7-star hotel. You will present an award by a Bollywood celebrity or some minister or something, and then that's how it works. So here if you see, I just received recently, thanks to Rajesh, I think Rajesh received this and advanced this to me. We got the Shyam Prasad Mukherjee Memorial Award. Who are the awardees? Sri Nathinde, Rahul Narvekar, Anurag Thakur, all those sort of ministers and ex-ministers. Or you might be lucky or unlucky to get an award from Bollywood. Okay, now the second part is this. Once you have paid the fee, there is a so-called evaluation process. There is no vetting. In fact, you can choose your award. I can choose to be the best robotic surgeon of Gujarat even though I don't own a robot. That's easily done, The third thing is a paid award. Now, the payment. Now, there are many packages here. Here you see the first package is 95,000 plus taxes where you get a print media exposure and you are given award by a lesser celebrity. If you spend 1,50,000 plus GST, you will be awarded by some minister or some senior Bollywood actor or actor, depending on your choice, and you get the YouTube media exposure also. And if you go for the highest award, it's some 3 lakh plus GST, you will be awarded by a minister and you get unlimited exposure, so far. So this is how things work, And then you get the trophy, you get the certificate. This is media coverage in local one newspaper called Divya Bhaskar. It's a very prominent newspaper in Gujarat. And I've been seeing this very routinely. You know, any town can has been present with this. And sometimes certain professionals, even friends are being presented. This made me compelled write to email to the Chief Minister. I said, your ministry, your office should at least write. You know, any town can have it should not be given such an award. But there is no response. Let's see what happens. And no newspaper is bad. Even Times of India does this. Every year I have a sense of deja vu in October. I'll get a phone call, sir, award mila hai, kya karna hai? They will award nahi lena hai, thank you. And then they have also different methodology. If you see, it's a sham. They say we select, we survey, nothing is done, nothing, it's all on your money, you know. And then of course once you get the award, you get the media coverage, and then you Google, YouTube, wherever you want to put, and then you can put on social media, LinkedIn, or Facebook, your WhatsApp, you know, your Insta, and then you get applause from your friends, your family, your patients, and you are happy. Wow, that's great, you know. So who will do this? Besides the media houses, the medical tourism boards do, even the pharma companies sponsor this. If you see India Today, again a very respected magazine, you know, this is where every year they take out in all cities, top 10 doctors in Mumbai, top 10 in Ahmedabad, and so on and so on. If you read carefully, there is this thing called impact. Whenever you read the word impact, focus, consumer connect, you know, all these means they are advertisements. They are so-called advertorials and not editorials. In fact, India Today even publishes that in a small, you know, this thing, corner somewhere that these are all advertisements. Okay, so what is the reality check? These awards are paid recognitions and they have a non-transparent selection process. So basically it's good for morale boost, you know, internal morale boost, but you should know this is not the right thing to do. What patients perceive? Patients appreciate friendly staff, successful outcomes, clean toilets, and a low infection rate. So the two indicators of success are this and not the other ones, you know, and that is where NABH comes in. NABH has been talked about before, right? And comparing NABH with hospital awards is like comparing apples with Instagrammable oranges, you know, nothing more than that. We went, actually, Urology Institute, we were the first healthcare in Gujarat to apply for NABH across the board in 17 years back. Many of you know my story. We applied, we failed, we applied, we failed. Thrice it happened, then we shut off it, we don't want to do anything. And then again we started in 2017, we got the pre-accreditation award. And now, for last 5 years, we are a fully accredited hospital. We are the first and only standalone urology hospital in Gujarat to be fully accredited. So the question is, has it helped? Well, we are doing well otherwise also. But I think it has helped us, maybe in terms of patient safety outcomes, infection control. So my advice to the young urology would be focus on quality, focus on patient experience, focus on ethical practice, and try to upgrade your skill always. So to answer, do hospital awards make a difference? Well, to sponsor awards, not really. Any evidence-based do really make a difference. Thank you.
Ashit bhai, well spoken. Before you go,
Yeah.
if you get an award at the hands of celebrities, which actress will you like?
And there are a couple of actors, not one.
One?
Yeah, he knows it. Thank you.
But fantastic talk, wonderful. I think
आशिफ भाई दिल की बात दिल में ना रखो हाँ तो पूरे बाजार को पता होने दो So we open this session for discussion and the first question was not answered. So this is not fair anyway. The questions are welcome from the audience also. Yes sir. Bilal. Ashish or Kishore, yeah. NABH.
These are not primary, these are called entry level accreditation. Entry level accreditation you can continue for years together because basically these accreditation are meant for smaller hospitals where they cannot have a bigger infrastructure or they cannot have all these 10 chapters standards followed by these smaller hospitals. So you can continue every 3 years this entry level, which is they call it as certification. Accreditation is something which is beyond that. So it is the final thing which probably Ashit was talking about. So there are many norms you have to follow, then they will give you accreditation.
The problem with final accreditation is the norms as far as human resources, qualified staff, qualified sisters, qualified doctors, which actually mean allopathic MBBS doctors. So both of them are really scarcely available. So then what do we do in that?
Nothing is 100% in India. There are a lot of loopholes which these people are only made. They only taught us. They only teach us how to go about it, and the things can be done. But as Ashit was rightly told, everything has to be from your ethics. Whatever is good for the patient, you have to follow that. Anything which compromise patient care, patient safety, I think we should not go for that. That's what I feel. Second most important thing is why this NABH that nobody talked about is for insurances. Even for yojanas and insurances, if you have this accreditation, then probably your packages goes up as compared to non-accredited hospitals. That is very, very important. 10% for us, Rohit bhai may have 50% more because you are good negotiator. Sir, sir, roughly, no, sir. I was just talking to one of the hospital in Nashik, Apollo, about 25 to 30 lakhs till you get the final JCI accreditation. It's not about their fee, but it is a lot of modifications and a lot of softwares you have to bring in the hospital. That costs additional cost to them.
So with that much money, you can get hundreds of PAIDS awards. Yeah. Yeah.
So basic parameters are same. Only there are few international standards which they come in JCI. NABH is basically a national body where suppose for the room size. NABH doesn't have that room size standard. They got OT size standard, but they don't got room size standard. In JCI, they start from your reception area, your consultation room, your patient in the IPD room. Everything goes up in JCI as compared to this. So basically, this is all American standards which comes under JCI, and that has to follow in Indian scenario. So the cost is more. No. But usually it is not worth for smaller bed hospitals. It is amount required to spend on will not be worth for the smaller hospitals.
Immediate accreditation, and we all see the advantages and because what are the disadvantages of anything? Because we have seen many times too much of pressure needs to for getting the accreditation. There are a lot of problems which keep happening.
Yes.
So what are the disadvantages of anything?
So the biggest disadvantage is it is only about paperwork. I personally feel by nowhere it increases the quality of the patient, quality care of the patient. If the surgeon is good, he is good for the patient. If the surgeon is bad, NABH will not make that surgeon good. So that's the most important thing.
Second is expense. The typical hospital charge you know capacity for 8%, and the maintenance charge is about 25-28%. So this is what the actual disadvantage. Here, if you see, I'm going to point out the here, charge of patient. So here, charge is and there's so much of people who are point of an actually. Actually, we don't the patient, ask patient, keep track with the patient, ask them how they are feeling. But they are just involved and giving the paperwork. They have to complete, they have to complete, they have to complete. And in the process, we don't even talk to them, patient from the area. So this is what is the disadvantage of a person actually have to understand. Yes. But basically, we are tracked because of the insurance and rating that. And we think that the patient is pretty good, but actually does not mean that everything is automatically good. There are other problems which is happening in the so we sure for smaller hospitals. For smaller hospitals, is ISO just to keep your system in place to document everything and not really go through all this.
Sir, all these years it was ISO only. Probably when these yojanas and insurance companies started making it compulsory to make at least entry level NABH, I think basic standards of ISO is enough to be implemented in every hospital, and that can be easily manageable also. And probably difference between NABH and ISO is ISO means you have to have your own standards also. Like they don't force you to make everything compulsory. There are few standards which, according to your self-assessment, is better for the patient care. That can be also implemented in ISO, which may not be in NABH and JCI. That's the basic difference.
ISO is basically predicting a process. NABH is more about patient safety also.
That is absolutely right. You know, all this accreditation is for the maintaining the minimum standard for the treatment. So patient is not harmed. And then we have experience, we had an ABH, and then after a few years they discontinued. Because the corridor length was less by a 2 feet compared to what their standard require. So if you are building a hospital, please go through all this requirement, because this is all scientific requirement. And then you may not understand when you are building it. At that time, about 48 years ago, the builders were not medical builders, the medical architect. They were other articles. And then we try to take this. But why this is required? Because it is somebody's experience that you are running the hospital. When patient is on a large and you have so many theaters running, you need to have a basic safety, and this is for the safety. Regarding the advertisement, what you talked about, and then we have been in the newspaper many times. I mean, that is okay. I mean, you are not asking for it; it's given to you. But when you have a hospital like ours, which is non-profiting and charitable, non-profiting, and in that case, this will helps to get the donation, and then donation which you get, you utilize for giving underserved population. We are in a district place, and there are lots of poor patients with this thing. When you are doing a kidney transplant, you realize that how much money you need to maintain that level. Because here somebody is giving kidney, you got to make sure that the results are good, and for that you need to have the finance. They cannot afford. They can afford to give a kidney, but they cannot afford to have the finance. In that case, you need to have recognition where you are do it. Not all the recognition they ask for the money. They didn't ask for the award, but then they say it is always a thing that your story we will publish it, and one page will cost this much. No, it's okay. You are recognized. You have to ask yourself, am I doing ethical thing? If the story comes out, because very often, because patients are not aware, they miss the diagnosis. The cancer prostate, initially we were getting, were all advanced. They did not know. Now they did not know that our prostate cancer value is not 4, it is 2.5. We did a survey of 35 villages. Now that costs money because we have to do free of charge. And for that we got to donation. And then when we do this, it comes in the newspaper. When it comes in the newspaper. So I think, there are very thin line between when the paid one, you do it for the earning money, and you are really doing for the health of the people. That is also very important. In the end, you have to ask yourself. Yeah, I think that is the most important. At the moment, we did in the school, and then we found that there are some minor congenital anomalies, but there are 2 girls were there who had a single kidney, polycystic kidney, and they had a kidney failure. They require a kidney transplant. They didn't know that they had hypertension. This is the reality of our country, not awareness. And that awareness you have to bring it to the patient to give them the proper. Now for that you have to try. You have to use some of the things. So long as you know that this is going for that, there is a honesty involved into that. I think there is a.
With that point that the benefit of healthcare should reach the last man in the queue, I think on that point we close this session and we ask him.
Thank you so much, all the speakers.